Hello, my name is Caitlin Chinski, and for my final project, I am doing the promotion of public and population health. The more I've done research into this, I've noticed that it's more so about the resources being provided either on a government level or on a state level to the minority population, or the population that doesn't receive the resources to healthcare that some who have insurance through work, insurance through other places, so they're not receiving the prevention that they need, the education that they need, or even just being pointed in the direction to receive care in general that they need. So to dive more into it, a definition I kind of came up with was it's providing the resources and educations needed to the underserved population. Just to break down some of these populations that I have noticed popping up more and more in my research is the first one is African Americans and Latinos, specifically males, have been the highest population that have seemed to be underserved. They're more at risk for diabetes, hypertension, stroke, those really big diseases that have pretty simple preventative techniques. A lot of education is required and a lot of resources are needed for that, though, and they aren't receiving that. Another one I noticed was the LGBTQ population as a whole, including specifically transgender and gay males. Big thing for them is providing with STI prevention and preventing the spread if they do have it. Immigrants in general, just no health care being provided due to lack of insurance. And then going back to the LGBTQ population is those that are living with STIs, just providing symptom management, like I said, and preventing the spread. The goal of promoting public and population health is we really need to aim to understand what each unique community needs. Every single community is different. Every single community has something that is more prevalent to them, and then increasing the education on that in that community. You can bring it to the people. You can bring mobile health care, get funding from government sources, which is some bills that I've noticed are being made, is looking at the importance of mobile healthcare units and giving the communities the funding that they need to provide this for their people. These mobile healthcare units can provide vaccine, blood pressure screenings, blood sugar checks, mammograms, lab draws that can check your hemoglobin A1C, your LFTs, your cholesterol levels, anything really. They can even provide you with the resources and education that you need to find that follow-up care that you need. Another thing is just increased education. Like I keep reiterating, it's the biggest thing about promoting public and population health. This education is about just the prevention of diseases, hypertension management, stroke prevention, diabetes prevention and management, those healthy diets that we see, the low fat, low sugar, heart healthy diets, how to check a blood pressure, importance of follow-up care, how to have safe sex, provide resources, all that. You could provide a blood pressure cuff, even provide a glucometer, provide condoms. Anything as simple as that is something that's very important to this cause, but does require a lot of funding, which is where there's more of a lack. But with COVID, it has become more pronounced, the need for public and population health, because we were all secluded, we were all inside, and a lot more disparities were highlighted because those are the populations that were also affected most during the pandemic itself. Overall, like I've said many times, the goal is to decrease those health disparities, increase health equity. Everyone should be treated equally. It shouldn't matter the color of your skin, your gender, any of that. Everyone should have the same access to healthcare. It shouldn't rely on how much money you have. You shouldn't have to penny pinch to see if you can receive this care that you need. And then just increase public health, increase their knowledge on everything, increase their understanding, and provide everyone with the resources that they need for getting follow-up care, getting preventative treatments, treating the diseases that they do have, and hopefully preventing long-term effects, which in turn, as healthcare providers, we're seeing these long-term effects. Once they reach the hospital, they're generally very sick, and that is a huge burden on healthcare costs. It's a huge cost factor for the patient as well. That's why they push off receiving care. So all in all, public and population health, very important. Provide the resources, get the education out there, save the hospital money, save patients money. Thank you.